Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullah. During my teaching experience with master students, we always face the problem that master students are not very familiar of how to read research work and how to read articles and how to put them in perspective according to their own research, how to make them relevant to them. Like after maybe 100 papers read, they will realize their subject and they begin to organize it in their mind and have an idea about it. But that's around 100 articles lost out because they were not concentrating on what they are aiming at. Okay, so the need was that, first of all, there is not a lot of experience with some master students who have not been exposed to research articles inside their dental studies. They have not been exposed to actual research papers, and they have not been reading methodologies of how research is done, even if they have taken research courses, and even if they have done research articles. Even if they have done research courses, these courses usually concentrate on collective data, not on actual individual studies. Okay, so like for example, they will be talking about evidence, and they will be talking about how to extract evidence and how to rank papers and how reviews are excellent and so on. So they will be concentrating on the final evidence and not on the process of producing the evidence, which are the actual individual studies. But once you begin in the track of research as a PhD or a master's student, now you read the papers differently. You're not extracting evidence from it. You are extracting methodologies for your own research, because you aim that your research is part of the evidence produced at the final end. So you're at, let's say, at the first stage. You're doing a study at the very first level. But because you have not been a researcher before, you're not familiar of how research papers report their methodologies. Even if you had read a couple of or a dozen of papers, you still are not very familiar. You might read the information and it will pass away as unimportant or not important. But then you discover, no, it was important. Where was that paper that I read? I lost it. Because you will be reading in the course of your master's studies or PhD studies maybe hundreds of papers. So you lose the track, okay? So the need that I found with my master students have made me develop with them this methodology where we concentrate not on the results of the paper actually, but at the methodology, how to report the methodology, and then how to extract the information from it. It's not the final result that we're asking for. Is this more effective than that? No. Is drug X more effective than drug Y? That's not the aim of our reading. The aim of our reading is developing our own methodology. So why were those papers accepted by high-ranked journals? What did they do different that made their research publishable and then could be even part of one of the evidence-based reviews? Okay, so this was the idea. So we're looking at the paper from a very different angle than the one you might be thinking that you're reading for. We're not reading for results. We're not reading for the final paper or study event. We're reading for the methodology itself, and we are I begin by choosing for my students two main sources. The first source that I like to depend on the studies, the individual studies. For example, if it's a medical research, I would concentrate on Cochrane reviews. Okay, Cochrane reviews. Why? Because the papers that went into that review were of high quality of scientific writing and high quality methodology. So if it's medical, I would go for the Cochrane reviews and let the student try to get the closest review towards his topic. Okay, try to find the closest review for your topic and then go to the included studies. There is a list in Cochrane papers. I do have access for Cochrane library, so I do have access for the actual paper where they do list the papers included in the review. So I would let my student go for the list of reviews. list of studies, okay, included in this review. And usually, the studies that we do and in dentistry, we're not talking about major medical studies, we're talking about selective, very confined angles of study. So the number of papers usually that we find in Cochrane reviews are usually low. So we're okay. We're not going to the reviews that have 10,000 of papers included or 5,000 papers included. We're not talking about a big subject. For example, we're not talking about hypertension, we're not talking about diabetes. In those Cochrane paper reviews, they include a lot of papers, okay? Especially the new reviews where they publish the review with the new references added. People got better and better at research methodology that their studies are getting more into Cochrane reviews.
Doctor, you mean list of the studies, you mean by list of the studies, the references themselves or the...
Yes, the references, no. Cochrane has, when you go into a Cochrane article, because somebody had made me participate in one of their reviews, so I know the process. So the process is that they gather papers, they exclude papers with poor methodology, they keep the good ones, and they are usually clinical studies. We're talking about clinical studies. And once they do that, those papers, they begin criticizing them. So even with that group, they further criticize. So the idea is that at the end, there will be something called included studies. Okay? So you have two exclusions. First of all, they don't enter the Cochrane review at all. The studies relevant to that subject don't even meet the entry criteria for that review. وفي عندك studies that go into the review, but they are criticized. Okay? Further filtered for or criticized or critique for some points of methodology errors that they find might produce bias in the results. So they are filtered twice, let's say. Now, the final result where their conclusions are based on, the final set of studies, they include them in a final list. So included studies. Okay? So I've been in Cochrane reviews as a reviewer, and I've been in Cochrane reviews as one of the studies included in their reviews, but it was critiqued for some points that were not possible at the point where I was doing that research. But the idea, just in the entry into the Cochrane reviews for my study, I went through the process of the critical, I went through the scrutinizing process where they asked about every bit and detail of the methodology. So I went through that experience twice, as a reviewer and as one of my studies entered into a Cochrane review and was evaluated for its bias possibilities. So this is how I got the interest. But the problem with Cochrane reviews actually for our master students is that this is related for clinical research. So it's only relevant for those that have clinical research on patients. And they're dealing with interventions, not diagnostics, for example, not methodologies, for example, of the treatment. No, you have to be dealing with the interventions and comparing interventions together. Okay? هذا بعمل editing anyway. المهم. So they are limited looking at interventions, not in vitro studies, for example. Even if it's an invention, even if it's an intervention, but it's made on in vitro samples, they're not put in those reviews. So that's the idea. So they are limited for some type of research. It's clinical research where interventions are compared and studied in comparison with each other. Okay? The second source that I rely on, and I begin by that for our master students, because simply sometimes we are, the time there where we began, where I began master, the second source where I look for and I ask my students to go to, and the reason why I'm doing that, because we have limited access to some of the journals, and not all of the journals are included in our library. I ask them to begin with open source papers. So I go for JOMI, open access journals. Why? Because these are open, they can easily go to them. I could pile up a large number of papers easily, so they could begin practicing on them. And sometimes some of the papers really prove valuable. It's not criticizing. بالعكس, on the contrary, the new open access journals are getting more and more into ranked positions. But at that stage where I began doing this, open access journals were not highly reputable as they are now. Now even, as you know, حتى the Independent has changed from paper to electronic version. So we're expecting that all journals might be going to electronic versions. And more and more are going to open access to increase the people that are utilizing their information and citing their papers. So even reputable journals are going to there. And the costs of the publication and the other editorial costs, they are just putting them on the teams, research teams, or the research funds that they are publishing from. Okay, so even open access journals where they allow you to see the full article are even growing more and more. For example, I remember when I first began with open access journals, I remember the number of papers that I could, or journals that I could open that are related to my subject. At one stage, I was supervising a student doing on cardiology. She was doing it as a local research, preparing for her master and PhD acceptance. She wanted some experience. I only could find 12 journals. Now, if you open for open access journals related to dentistry, maybe more than 80 or 90. So it's exponentially growing. So you're getting more and more better quality papers, you're getting better quality, and you're getting more open access articles. So what happens is that when the student begins by this, it's low cost for the student because everything is free and just go do a search of the internet and pile those papers and begin reading them in that method. The benefit is that it doesn't cost them a lot. And discover then later on that this paper is not relevant to their research. And this happens. The student will be paying a lot of money for access to these journals or asking people abroad to send them such papers or the researchers that are interested in their same research. So they spend a lot of time, money, and effort, and they discover the paper was not worth it. So once they perfect their methodology using the open access journals, now they are more selective in going to articles that are limited access or need some subscriptions or otherwise. So good training material. And now it's not even a training material, I consider it quality material. There are more and more journals that are good ranked and have good ranks of impact, even if they are open access journals. Okay. Also, I sometimes ask students to go to the final group of papers that I go for are the papers that have the final group that I ask the patient. The final group of journals or articles that I guide my student to go to is after they gain the experience from this training, they now begin understanding what is the effect of what we call MESH terminology. Okay, so I begin training them on that. يلا الفيديو شغال بس ايش اتاكد من الكود تاعها لان من زمان ما فتحته على Pubmed. اوكي لا اله الا الله. Pubmed. Okay. So how do journals. حتى البابميد تغير من لما كنت اشتغل عليه، بس بدي اتاكد من هاي الترم MESH ولا في حرف ناقص. أنا جو MESH terminology. أوكي هاي أكتب كده. Okay. The third source that I ask my students to go to and begin playing with is the MESH terminology. So what is it that? It's the organized index in terminology for cataloging medical terminology. The idea is that, for example, when we're talking about any subject, there are some keywords for looking for that subject. So your research is about fillings and microleakage, for example. So that means we're talking about dental, we're talking about fillings, we're talking about material, and we're talking about in vitro studies, we're talking about microleakage, we're talking about viewing, diagnostic, and so on. So what you get from the first set of papers, that you begin developing your terminology and you begin perfecting them. Okay, for example, you begin to know that from the first set of training, you begin knowing that microleakage tests are multiple. There are multiple ways of looking at microleakage. Even the material that we put the tooth in to study microleakage are different. Somebody uses dyes, somebody uses biofilm selective films, like they use type of acid. They use some type of pH cycling before the microleakage. Some studies do microleakage studies after introducing a biofilm, because biofilm is selective in terms of material going through. And so you get the knowledge into that. Even the material itself, even the dye itself. Some dyes are fluorescent, some dyes are only just color, some dyes are even, they have some properties where you can detect them with other types. Even the particles themselves inside the dye, depending on the size of the particle, you have multiple microleakage studies. So the idea is that you begin going into the bits and pieces of the terminology related to that research. Okay, so you develop this. So using this cocktail of terminology, that now you begin understanding in their actual scientific meaning, you begin putting them you take them from the open access journals, you begin putting those combinations, you go to Pubmed, because Pubmed is one of the most famous medical papers. Pubmed is one of the most famous search engines for medical research. So you go there and you put that terminology and you begin playing with them. Okay? For example, you might, if you did not do this methodology that I'm talking about, you might go say, microleakage, dental fillings, and you get maybe 20,000. والله جربيها. You might get like 20,000 results. Hey Pubmed. So let's go to Pubmed. Okay. So for example, if you open PubMed, for example, journals, and let's use the very, very basic terminology. Let's say microleakage. This is the subject that you're studying. Microleakage. Dentine or dental filling. And dental filling. How many papers do you get? في بآخره. Okay. صح. Okay. So if you use that general terminology, what you get is a huge number of articles, and you're not very specific which one am I going to read. Maybe in thousands, okay? Especially for very popular terminology like caries, secondary caries, fillings. Those have huge number of articles beneath those terminology. When you begin perfecting your terminology, for example, you're only using fluorescent dye, you begin putting the word fluorescent into your search. So that lowers and lowers the number of articles that you need to read. And also it's more specific and relevant to your own research. Okay? So that's the idea of perfecting this. So we begin with the student taking out the MSH terminology related to his research, confining them, and then begin using the PubMed. So these terminology, we use them under PubMed for searching. And begin selecting articles that are studying the same area that we are studying. For example, you might find fluorescent dyes studying the root end microleakage for endodontics. It's not relevant for us. We're talking about dental fillings. We're talking about regular fillings, not retrograde fillings, or not retrograde sealants, or so on. Retrograde sealants. So we and them, for endodontic purposes and for filling purposes, we are using the same dye. But we are related, for example, for fillings, coronal fillings. So we begin perfecting that cocktail of terminology, where we are aiming more and more specific at papers that are studying the same line of research that we're working on. Okay? So we go to the PubMed at the final stage. After developing this methodology, either from Cochrane review lists of articles or open access articles. Now, why do we use, I told you, open access journals? Because most of our research that we do are in vitro studies in our master program. There are some master programs that do clinical research. So it depends. I guide the student according to his research. So I begin by open access journals because they could get the full PDF of the paper immediately. So we begin training and save time. So I'm not waiting for you to go to the library, try to find the periodical, try to get out the paper, take permissions, pay, and so on. Or wait for your cousin or so on to send it to you if they have an access. So that's a long process. Sometimes people spend like 1, 2, 3 months doing the literature review, and they find at the end that most of it was a waste of time. Okay? So this is why we get it. Okay. So this is our methodology we're going to follow for your research. So what am I going to do? Take out an article, please. Do you have any article? Any article. Choose any article. Of course, I would trust that you have brought something relevant to your study. No, from your papers. I want an actual article that you're holding. Why do I need an actual article? We begin with an actual article because we need to open pages and compare and go back and forth. The first article might take 5, 6, 8 hours for us to study in the way that I'm talking about. You will reach a point where an article will take 1 or 2 minutes for you just to fill in. We're going from this extreme to this extreme in terms of time management. So the first article will be the most article you will read, the most thing that will be relevant to you. فمعك article PDF article حقيقية PDF أنا بدي هذا اللي بدي. Okay, we're going to choose for our training purpose a full PDF article. So we're talking about, this is not relevant to your work, pulse oximetry,
No,
pulse vitality.
it is not relevant to my work. It's just an article.
Just an article.
Something relevant to my work.
معك أي شيء عن feelings microleakage أي شيء زي relevant؟
No, I could search the internet.
Okay خلينا ناخذ هاي fine for me يعني لا بس برضه I would prefer something methodology يكون فيها methodology فيها material فيها معك شيء مسير شفتي كيف إنه محتاج open access أصلا
Yes.
ليش ال open access أسرع you begin training on this is why I use open access. While you're searching for the paper that we're going to look at, and this exactly proves the point we're talking about, how open access journals provide us with quicker tools to go into the procedure. I want something relevant to your study. Microleakage, coronal filling, teeth, extract teeth, what else?
The material itself, which I want to study.
Okay, you can use any material, even composite. You can use any. For example, you might have some papers that are talking about the microleakage of thermal insults. They're studying thermally. They're studying the microleakage thermally, not so those are out of your scope. Okay, so I want something relevant, yani. But the idea is that while you're searching, and this proves the point why we need open access journals, you want a ready article that will save us time and just begin on it immediately. Go through it. And because you have already done a draft of your protocol, you are more specific than when you began your research at the first point of idea. So
Yes.
now you're confined a bit more. But once you perfect this, you will be so organized and so focused that nothing will be wasted, inshallah. So while you're searching for that paper,
There is no internet.
okay, while we're searching. Okay, let's say we do have a paper. I don't have a paper now. Let's say we do have a paper. Okay, what do? I open an Excel sheet. Regular Excel sheet. Okay, suppose we have a paper. You don't have it today, but we can use this recording. It will give you the idea. Next session that we will be filming will be you running the process on 2 or 3 papers only. We don't need more. Okay? And then we will begin criticizing and talk about the experience of developing this. But what you will get from one article is usually that you open an Excel sheet. Okay? In an Excel sheet, you will find that you can develop a table. Okay? An Excel sheet opens immediately. You open one sheet, okay? We're going to call this methodology sheet. And then one of the options here is the design of the table. Let's select, say, 10 columns. I'm not going to begin with more than 10 columns, okay? I'm going to select this area. And I'm going to make these 10 columns go for 2 studies at least. I'm going to begin by 2 studies. Okay? I'm going to say this is the study. Say number. Study. Reference. Okay? And this is a good point where you begin training yourself on how to write references at the end of the thesis. So at this stage, I tell my student, go and look at the requirements for your master thesis writing style. So is it Harvard or Vancouver's style of referencing? So from the beginning, the student knows how to write a reference down and how to write it in terms of the article name, the journal name, the dates. Do they need the authors at the beginning before the title or after the title of the article, and so on. So it depends on the style you're going to use in your thesis. So because we are within a university premises, we begin from that stage. I tell them there are two styles that our university is asking for. There are more than two styles of writing references, but the idea is that our university is concerned by two styles of writing. So begin from now, writing down the article perfectly into the reference. Because at the end, when we do our literature review, we simply copy and paste this and put it into the literature review reference list. Okay? So this is the first study I began with. I might code it later on by something else. And then, so they write the study reference. And I tell them that within any methodology, there is something called, okay, I'll open another I would tell the student there is a subcategory where these articles usually are organized as, and those are, there is a pre-research stage, okay, I could join this and say pre-research, which includes usually the inclusion criteria, the exclusion criteria, the populations that they studied. For example, some case studies go to schools, some studies go to medically compromised patients, some studies go to health centers and study those as a population. Some studies go for volunteers, some studies, so we call them the research population. Inclusion criteria are there, exclusion criteria are there. Sometimes sample selection, sample preparation, okay? Pre-research stage. And then we have the research stage, and this is also a subheading. Okay, research stage, which is actually where methodology is applied. So let's call it, sorry, let me just rewrite it. Down I'll say methodology stage. Methodology. Okay. Let me just wipe it and say test stage. Okay? And post-test stage. Post-test. And then others. I would say here is others. What are others? They include the type of analysis they used, maybe the type of statistical analysis, maybe type of data, reorganization of data, maybe that would be follow-up periods, okay? Because follow-up periods are outside the testing time, so it's a follow-up. So those are after, and others, okay? So I begin reading a paper, and I will find that pre-research stage includes the aim. Okay, aim goes here. Then I discover that there's something other than the aim here. Okay, for example, inclusion criteria. Then sometimes, look, I began by 2 columns, but once I began reading that paper, I found that the pre-testing stage, let me change this, because I've changed this, let me do this as well. So let's say pre-testing stage. Okay, I'm talking about the aim. Let me put them here. Pre-testing, testing, post-testing, testing, others. Okay. So you get the inclusion criteria, you get the exclusion criteria. You get the population, for example. You get sample preparation, prep. For example, storage material, time of sample storage, ways of collecting samples. Did they put a container at the dentist's location for them? Have they reported on sample treatment before the testing? We're not talking about actual testing. We're not talking about washing the teeth before doing the test. No, I'm talking about in between, waiting in between. What did you do? From the point of your approvals. Sometimes here approvals apply. Pre-testing approvals, IRB approvals they got for human research, for example.
What I want to do in my research.
Exactly.
So,
But
yeah.
after the actual testing begins. Sorry, before the actual testing begins, okay? So you'll find them. So sometimes you will find like 5 papers having these, and suddenly there is a paper that didn't tell you anything about the population. Where did they collect the teeth from? Or sometimes you're working and then you discover one of the populations of the studies were bovine teeth from animals. You exclude them, for example. You're doing human, for example. Or you're going for bovine and you're excluding human samples. Because bovine, enamel, and dentine behave differently. They don't have the same chemical composition. And there are papers that criticize and differentiate between human dentine and bovine dentine, or human enamel and bovine
So I
dentine.
could include that in my inclusion criteria.
At the beginning of your methodology,
Such as human teeth, for example. Yeah.
Mahu, sometimes you discover that the paper didn't even say anything about the type of the teeth.
Yes.
Yes, there are. And you might discover why were their results so odd. You discover that they were using bovine teeth. So this is the idea. You begin discovering papers. You begin discovering their weaknesses and strengths. And sometimes you go like 50 papers, and then one of those 50 papers reports something that nobody did before.
Yeah. So I report it.
You report it, so you add the paper here, you add you begin adding, I know it's now crowded, but the idea in Excel, that's good. You begin adding columns, inserting a column here. And this will be none for the 50 papers. And maybe the paper number 50 will be reporting that they done so and so. So this is the good point. This table grows with you. So the idea, the growing of the table means the growing of the categories of terminology inside your mind. And you begin more critical at reading and more scientifically oriented at comparing between study methodologies. That's the idea. So the table grows. So that's why I'm not really worried about my handwriting at the moment, because I know each time I'm going to add a table. So this is good about Excel. I begin inserting a column, inserting a column, inserting a column. So the good thing that I'm still in the pre-testing stage. I'm still adding here, for example. Okay? So that's the idea behind it. So begin going to the testing stage. I begin finding that at the beginning of the setting stage, somebody would begin reporting the machines. Sorry, this is the heading. Okay, they begin reporting the machines. So we ended here. Machines they used. So you begin reporting the machines. You discover after 10 papers that, wow, that machine, we need it. We don't have that machine. We don't have that testing device. We don't have that material. Because so many papers are doing that. And we're talking about highly ranked papers. Okay? So when we go in the first training step, I'm not really concentrating or paying attention to the rank of the study. At the first 10 maybe studies, I told you we go to the open access, we train on that, and then we go to the highly ranked journals that have papers in them. Okay? So why did that good paper or good study find its way through publication in that journal that has a very good impact score? Because their methodology was good. And this is the main reason now. I'm talking about now. I'm not talking about 10 years before and so on. Because the publication process and the editorial process of journals is shifting and settling towards more and more reliable practices. So methodology is number one. For example, at that stage where we were doing research, talking about maybe 10 years where we began doing research, only papers with positive, significant results were published. Now it's allowed to publish negative results or non-results, non-significant results. It's allowed as long as you have good methodology. So it's more and more focused on the methodology, not on the result.
Should we rely more on the recently published studies concerning the
Okay, this is a good question. Do we need to go for recently published? I would say yes. Because recently developed papers, first of all, have more advanced devices. They already went through the critique of methodologies before, and we're using papers from high-ranked scored journals. So yes, I would go time-wise, chronologically in the papers, going backwards. Yes, I would do that. But where do I go? You're going towards the final result. I'm telling you, I don't go to the final result unless I perfect the methodology. So the first 10 papers, you might not have the best paper or the best methodology in it. But it's for training purpose where you begin developing your table and you begin understanding. So sometimes you discover that this paper's results are different from the other paper because they used a different machine to see, even if it's the same die. Even if it's the same sections. For example, we're using a section of so-and-so. But they're using a different machine, okay, to test it. So or they're looking at something else. So here comes the machines, the preparations, the actual preparations of the sample at the moment of the study. How did they section them? How did they store them? What is their media? How did they age them? For example, there are some, in the pretest, you discover that aging is part of the pretest. Aging of samples, because more and more papers are relevant. They don't like to look at fresh material out of the box. They would like to look at samples that have been stored in water for a very long time, thermally cycled, for example, and so on. They're subjected to the same environment of the mouth. We're not talking about fresh samples, fresh teeth, fresh material, fresh bonding, for example. Okay? So aging sometimes is considered part of the pre-testing, or just immediately before the testing step. But there is a storage or aging. Aging has different methodologies to age a sample. You could age it by different thermal aging. You have thermal aging. You have pH cycling aging, where they are subjected to pH consecutive pH solutions between alkaline and acidic and so on to resemble the acid attack, the recurrent acid attack that happened in caries, for example. That's important. Sometimes it's fatigue cycling for materials, prosthodontics we're talking about. So the cycling or aging of the sample is more and more, gaining more and more respect. Okay? We have also the deterioration of the dentine itself. By time the bonds deteriorate. So even storage in water at 37 degrees is considered good for some studies. Okay? So you begin the media. How do they look at it with the microscope? The sections length, the line of cut for the sections, what do they do? So I begin adding in tables, because I told you we might begin by 10 columns, but we will end, after 3 papers, we might end with 60. Because you begin to look more specific. And sometimes, as I told you, the number of columns is not fixed. And the more you add papers, the more they will be reporting things. And sometimes, a good thing is that it's not reporting of the procedure or the media or the temperature. It's explaining why they chose this temperature. That's even more and more. So for example, let's say they stored this in normal saline for 37 degrees for maybe 3 months, these samples. But you get an artistic here, because this paper was so good, and they begin giving reasons. So there is some section in the table down here. Okay, we add reasons. They are very good. They begin explaining. This temperature does so and so. This cycle, for example, let's go for aging. They do a fatigue age, where they put pressure on the samples between 20 newtons to 200 newtons. And then they begin explaining. And then you get some papers saying from 0 to 100. Papers and so on and so on. And then you get a 12 paper that will say, we have excluded 0 Newton because at 0 Newton and going and putting force on the tooth, that means there is some impact strength. So they begin explaining why they did not go from 0 to 200. They went from 20 to 200 or from 5 to 200. That's a good